Our nose is at the center of our face, and that is the reason why it gets such a lot of attention. So many people are bothered about how their nose looks and how they could change the appearance of the nose and thereby change the entire look. So what are the options that we have for changing the way how the nose looks? I am Dr. Shilpi Vidani. I am a plastic and aesthetic surgeon at SB Aesthetics, Gurgaon, India. So there are two options broadly. One is a non-surgical option and the other is, of course, a surgical option. The surgical option, as I've discussed in so many videos, is a permanent option, and it involves changing the structure of the nose, whether it be the bone or the cartilage or the ala width, and a lot of changes can be done in a surgical rhinoplasty. We may also need cartilage from other places, for example, the chest or the ear, to change the way or transform really the way a nose looks. But what about a non-surgical option to change the way the nose looks or enhance its appearance? So it's very popularly called a liquid rhinoplasty. Now in liquid rhinoplasty, we use hyaluronic acid fillers to change the sharpness of the nose. And that is why when we are adding fillers on the center of the bridge of the nose, it actually enhances or sharpens the appearance of the nose. Now, if we think logically, obviously, when we are using fillers, we cannot make the nose slimmer, but we can improve the sharpness of the nose, and that is how it can look slimmer, although in reality, it has not become slim at all. When we are adding volume on the bridge of the nose, what happens? A flatter or a broader dorsum or a broader bridge of the nose starts appearing narrower, and that is how the width of the ala can seem a little less. The width of the nose base can also seem a little less, and that is how we can change the sharpness of the nose. So there are a lot of candidates who qualify for a liquid rhinoplasty, but one must know that it is definitely a temporary option, because as with all other hyaluronic acid fillers, the body will absorb it slowly. And generally, you may need a repetition in about 1 to 1.5 years' time. There are many men and women who've gotten a liquid rhinoplasty done and have maintained it well in the last 6 or 7 years also. So it depends on how we are doing the treatment and how much of filler we are adding, where we are adding the filler. Addition of filler to the sides of the nose will obviously make it look broader, and then even the safety of the procedure is compromised, because there are a lot of blood vessels around the nose, and we need to make sure that we are following all safety protocols when we are doing a liquid rhinoplasty. So essentially, a liquid rhinoplasty is the non-surgical nose job where we are adding the filler to the dorsum of the nose, thereby making it look sharper. It's a quick procedure, an office procedure, and you can get it done almost in about half an hour's time. But yes, we need to make sure that you are the right candidate for it. So for example, if you're bothered about a hump, we can definitely make it look straighter by the addition of fillers. If you've got a broad dorsum, you can definitely have a sharper profile of the nose with the fillers. But again, the patient selection has to be at the center of providing a solution. Now, when we're talking about a surgical rhinoplasty, obviously a surgical rhinoplasty is a permanent procedure, is definitely a procedure that you would want to do if you want to transform totally how your nose looks. So definitely there are a couple of choices, but you need to be well informed as to what option you choose for yourself. Now there's also a group of patients who are unsure whether they want to opt for a surgical rhinoplasty yet or not. And for them, actually a liquid rhinoplasty or a rhinoplasty with fillers can be a good option, and they can buy some more time while they are thinking about a surgical nose job. And it can actually make you realize how a sharper nose would look on you. Now, if you want to still opt for a surgical rhinoplasty, then obviously these fillers can always be dissolved and you can always opt for a surgical rhinoplasty. If you have more questions about nose jobs, you can definitely write to us in the comment section below. For more such videos, please subscribe to the channel, and thank you for subscribing to our new channel SB Trichology. We regularly post content about hair and hair transplant in that channel. Thank you for watching.